Hello, my name is Flora Hepp, and this is me and my team's company, InflamEase. In 2013, my grandfather's last request was for his Filipino dish, pancit, which serves as a symbol of health and nutrition and longevity in my culture. Unfortunately, we lost him, and it was unfulfilled, and this put me into a fervent commitment to combat this crucial healthcare problem, malnutrition. It has been very hard to deliver highly preferential dishes to patients through different backgrounds, and we want to deliver highly customized anti-inflammatory diets to patients with diverse taste preferences and nutritional needs that work for them because the current model is inefficient and lacks scalability. What if my grandfather was presented with multiple suggestions for a diet that fit his personality, fit his lifestyle, and also took into his cultural background and medical history? That is why I'm excited to introduce to you my solution, InflamEase, where we are able to revolutionize healthcare by taking in patients' personal preferences, dietary restrictions, everything, and make it tailored based on nutrition to take back their control of their lives. By empowering these individuals, we are able to streamline the database management process so dietitians are able to spend more time with the patient, thus ensuring their well-being of our community and reducing this burden to society. User experience is the forefront of our platform. InflamEase is our MVP as a digitalized intake form, where we are able to have the user volunteer cultural demographic information, and we are able to analyze this program with our AI to provide the patients with instant access to their dietitian's recommendations, as you can see in our demo. These personalized plans are delivered through dietitians and trusted nutritionists in the community. We have a subscription model, and we plan to aggregate user data to offer valuable insights and tap into additional revenue streams. We have also identified healthcare partnerships, such as this morning when I went to Mass General's Department of Food and Nutrition and Food Services, and I pitched them to pitch my platform that directly supports their sustainable initiative at the Eat Street Cafe. This partnership will be able to would be the foundation of our beta testing, which will allow us to refine and perfect our platform. And with their endorsement, we aim to tap into their extensive network to connect directly with even more dietitians and to make these connections with nutritionists. The business model puts InflamEase at the forefront of nutrigenomic research, and this is uniquely purposeful for our platform because we have the potential to utilize nutrigenomic data with dietary preferences, which will, as you can see, is in the millions in our addressable marketplace. I couldn't have done this without my team. We have been able to come back from focusing on cancer survivors to pivot and now focus on nutritionists who are in the area and equipping them with the tools that they need to fulfill this mission. And I would like to say that InflamEase is set to transform the way we approach healthcare, empowering health through culturally tailored nutrition. Thank you.
On the money, 5 minutes. how do you think you'll find your first 100 customers?
Yes. So I have reached out to MGH's Food and Nutrition, and I'm currently in the process of setting up a meeting with them. They have our marketplace of many dietitians and nutritionists, as well as me and some of my team members listen to podcasts, and we aim to directly reach out to these dietitians who already have a customer user interface and are already working on together with these solutions. So we are utilizing the businesses of people in the field that have backgrounds.
The $20 a month, is that paid by the person eating the food? And
Yes, we are figuring this out. We hope to work with healthcare insurance.
and what they receive from the nutritionist or the dietitian is a menu, basically. This is what you should be eating.
Yes.
Hey, good job, guys. Can you help us understand the benefits to this versus the patient just engaging one-to-one with the nutritionist? And then the first initial month, I would imagine they're getting a pretty robust product delivery to them. Is there something that changes over time, month to month, to encourage them to continue paying the $20 every month?
Yes. To answer the first question, we want them to spend the one-on-one time with their nutritionist and dietitian. We are marketing this to the dietitian. This is a tool for them to use to empower the patient. This is a long-term model because we want to include more settings to our app and to our model to include in-app purchases that they are able to support themselves. And we then want to be able to use nutrigenomic data to ultimately have these personalized preferences and diet plan.
I did want to add to the first 100 customers. Additionally, we will be working with social workers in the community, so people who are intimately connected with the patients and see who doesn't have food in their fridge, who really needs to benefit from a program like this. So that's going to be major, and Flora's already gone and talked to the people over at the medical place, and they're excited. So this is a solution. It's a win-win-win in a lot of ways, and the MVP is going to be great.
One more question. You're running out of time.
Okay, really quick. Going off of that, once people get a menu, where do they get this food? How do they get it?
Yeah, so with given more time, we are recommending where to get these foods. We wanted to build it into our model where we are tracking the prices. So the patient, the customer will be able to see these plans, be able to click on it, and be able to know where to get these foods. And they would be able to be suggested different kinds of foods to ultimately validate their new lifestyle choices. So they would be able to hopefully be able to get these foods in a way that is sustainable for them and they can afford.